the new location of Ponte Vedra Vein Institute, Gate Parkway, and I'm here once again with Dr. Megan Deacon-Casey. She's the medical director as well as an interventional radiologist, and we also have her physician assistant, Crystal Boatwright. Thanks for having us.
Good morning.
Thank you. Good morning.
Beautiful new location.
Yes.
And today we're talking about vein disease. So let's start with you, doctor. What exactly is vein disease?
So vein disease is a process that occurs in the legs and actually can occur in different parts of the body. But when it happens, you have faulty valves that don't work very well. And what it does, it causes extra blood flow to go in the wrong direction in the legs. So with that, you get increased pressure, increased volume, and what that does over time, those veins get larger and larger. You start to see some of them on the surface, which are called varicose veins. They're usually large, swollen, and bulgy. And then you can see other parts of what venous insufficiency can do, such as spider veins.
Right. So let's talk about some of those symptoms. Crystal, what can you tell us about vein disease symptoms?
Well, patients can experience heaviness, aching, fatigue, restless legs, cramping, swelling, and skin changes. If you kind of look in your ankle area, you can see some brown skin changes. We call that hyperpigmentation, and that's actually the iron from the blood that tattoos the skin, and that's a sign of skin damage that can lead to open wounds and sores.
Oh, interesting. So let's talk about why someone should seek treatment and when.
Well, definitely if your symptoms are starting to increase and interfere with your activities of daily living, as we call it, if you can't do those things that you love, if you're noticing your legs feel more tired, we tend to associate that with life. But, we were made to walk. We were made to do activities. So if it's starting to impair your lifestyle, the sooner you get it treated, the easier it is for you and better results are.
Definitely. Let's talk about if another provider, doctor says, you don't need to worry about this, you don't need to do this treatment. What would you say to that?
Well, we hear that very often. It's only
really?
because, yes, it's only because other physicians who don't necessarily practice in this field don't understand the long-term sequelae of chronic venous insufficiency. And like Crystal said, there are multiple symptoms, but over time they can chronically get worse, where they affect everything that you do. Your skin can break down, you can have difficulty walking, you can have pain that affect you every day. Other symptoms such as restless legs and cramps at night keep people up so they don't get a restful night as well. So we don't necessarily want patients to kind of go over into these chronic symptoms, including lymphedema, which we see people with those larger legs and trunks that are thickened skin, and it's really hard to turn it back around or treat it when it gets to that point. So you want to make sure that we're treating at an earlier stage so that you can improve the way patients feel.
And prevent it from going that far.
Correct.
Let's talk about the new location. Congratulations once again. Where exactly are you and what do you offer here? Same as the other location?
Yes, we're excited about this location. It's in the Gate Parkway location. It's behind the new restaurant called Culver's, across the street from IKEA. We offer the same services that we offer at the Ponte Vedra Beach location. And at that location, of course, we can still do all of the venous insufficiency, vein treatments, venous ablations, phlebectomy, ultrasound-guided sclerotherapy for spider veins as well. We want to make sure that we're looking at everything. Our comprehensive diagnostic exam is also performed here. And then we have the additional aesthetic services that we perform at the other location as well.
All right. Well, how can folks get in touch?
Well, they can just give us a call at 904-280-0600 and call for your complimentary vein screening.
All right. Well, thank you both so much. Good to see you.
Thank you. Of course.
And if you'd like to see this segment again, just head on over to firstcoastliving.net.